women have bared the burden that has been foisted upon us by
Mm-hmm.
society, but unfortunately we have not readily, but we have taken it on and not given it back. We have bared the burden of
Yeah.
guilt and shame and fear and
Mm-hmm.
cloaking things in secrecy. So all at once, we don't talk openly about our periods. We don't talk
Yeah.
openly about how deeply uncomfortable it is to be pregnant. We don't want to come across as whiny or complaining. We want to show that we're just as strong as
Yeah.
men, which, by the way, we clearly are because we're doing everything they do while we're growing humans, while we're menstruating
Yes.
once a month, while we're becoming menopausal.
How are you sleeping? Are you sleeping? I'm Dr. Shelby Harris, clinical psychologist and director of sleep health at Sleepopolis, where we dive deep into all things sleep. If you like Sleep Talking with Dr. Shelby, take a second right now to like this video on YouTube or give us a 5-star rating through Spotify or Apple Podcasts. It seems simple, I know, but it helps us reach a lot more people to get them the rest that they deserve. And if you're tired of hitting that snooze button, hit the subscribe button instead. A new episode of Science-Backed Sleep Tips is available every other Wednesday. Is great sleep really possible when you're pregnant? What changes should we be prepared for across the 3 long trimesters? And more importantly, if things don't go as planned, and really, when do they ever? How can our mindset help us pivot and persevere for the best health possible during this transformative time? To answer these questions and more about the ways pregnancy influences sleep, we've invited Dr. Shieva Ghofrany. An OBGYN since 1999, Dr. Shieva has welcomed patients to her private practice, Coastal Obstetrics and Gynecology, for over 20 years. Named as a Castle Connolly top doc, she leverages her experiences as a mother of 3 and an ovarian cancer survivor to empower women in their health journeys through her online platform that she co-founded, Tribe Called V. Dr. Ghofrany is very amazingly vocal in guiding her patients and social media followers to overcome their fears and learn more about their health. Dr. Shieva, we are so excited to learn more about our health from you. So thank you for being here and welcome to Sleep Talking with Dr. Shelby.
Dr. Shelby, thank you. I always laugh when people say I'm amazingly vocal because I'm really just vocal about everything, right?
Right? It's funny.
Yeah.
It's like just talking about health. It's like was taboo for so long. And now we're actually really talking about this stuff, especially OBGYN issues, which we need to be talking about way more. And thank you for being a pioneer in this area, really.
Well, I'm glad that you have this podcast and this platform because you're right. We have to talk about it more frequently, more vocally. And I say this more, I think we have to talk about it more casually so we don't make it seem so anxiety provoking and taboo. So I'm excited for us to talk about that today.
So let's talk about pregnancy, a time that, people wouldn't even acknowledge probably and talk about for years. And, it's pregnancy. Let's talk about what happens in our bodies, the changes that happen. So during pregnancy, our bodies are pretty much continually growing and changing throughout all the months that we're pregnant, inside and out. And I found it really quite incredible, all the changes that happen. I have a 14-year-old and an 8-year-old myself. So I mean, it's just amazing what happens. So some of these changes are quite obvious, but others really not so much. And to better understand our needs and sleep needs during pregnancy, can you talk a bit about the different stages and the changes that happen? Because I always think about it as like first trimester, second trimester, third trimester. What are the changes that happen in our body and things that might, sleep needs or sleep changes over those trimesters?
It's such a good question. And it's so fascinating to me because you probably hear this also in your field, but people say to me continuously, no one ever told me this, or I never knew that, XYZ. And I always joke like, no, I told you, I said it. I'm the one who's out there. But the truth is there's no way to fully prepare anyone. I mean, despite being an OBGYN, when I had my own children, there's no way I was truly prepared, even though I knew what could happen to our bodies and what I would feel. And it had been described to me by my patients. You just don't know it until you've actually been through it. And frankly, I'm not even sure it's necessarily good to hear every single thing. I mean, I'm a very big fan of preemptive knowledge. And I continuously say to my patients and anyone who will listen, I want to tell you these things ahead of time, not in a way to scare you, but in a way so that I can sprinkle it casually so that when you hear it or feel it, you're already like, oh yeah, I remember. I heard something about that. That said, again, until you've gone through it, there's really no explaining some of these things because,
Yeah.
as you touched upon, each trimester, our body goes through something different. And we can describe the general things that we know might transpire, but
Yeah.
every person actually goes through these experiences a little bit differently. So classically, we say the first trimester, you might remember, you feel really, I describe it as you feel so sleepy that you
Yeah.
just want to take a nap. Whereas by the third trimester, you're like sluggish and physically exhausted from the weight and the swelling and potentially all the other things like hemorrhoids and everything that affects you.
Hmm.
And then you might be lucky where in that second trimester, you feel better, but people kind of paint this picture of second trimester, you feel great. And I always say, well, I don't know if you're going to feel great. You just feel much better than the first trimester where nausea and again, that like, God, I really need to take a nap is overwhelming you. And you and I know that
Yeah.
there's a lot of physiological reasons for these things to happen outside of the obvious, you're growing a human, so it's just going to be tiring, right?
So is the first trimester more about hormonal changes? Like that's really causing the sleepiness? Like why is it that so many, I remember like I had to like stop. I was working at the hospital at the time. I had to like close my door and take a nap sometimes. Like
Exactly.
why is that happening in the first trimester?
You're right, right? You have to, I mean, this is what I described to everyone. You just want to take a nap. So there's a
Yeah.
couple of different factors, right? Progesterone's effect really predominates in the first trimester. So that
Hmm.
actually causes you to be kind of sleepy during the day for some reason. And
Okay.
interestingly, while we give progesterone postmenopausally and perimenopausally now for sleep, as you know, during
Yeah.
pregnancy, it seems like the progesterone probably makes you sleepy during the day, but might lead to some of that disordered sleep at night, coupled with the physiologic changes
Huh.
that progesterone also triggers. For example,
Okay.
progesterone relaxes our GI tract. So you get
Yeah.
more reflux. That
Oh,
reflux will wake you up in the middle of the night. We don't really know why exactly, but many of us have a lot of leg cramps in the middle of the
yep.
night. That was something that no matter how much I described it to patients until I had it, boy,
Yep.
that is actually one of the most indescribable pains that until you've experienced it, I don't think anyone can really, really understand it. It seems like you're probably
100%.
just complaining too much, right? But it
Yep.
is overwhelming and just terrible.
Yep.
And then there's other things in your first trimester because you might be very nauseated. That might mean you're not eating nutritionally dense foods,
Mm.
which means you might have less energy from that. Your blood pressure also tends to go down a little bit in that first trimester, which can make you
Oh.
be tired. You might be taking medications for the nausea, specifically these over the counter medications that help with sleep called doxylamine that you probably know
Yeah.
very well.
Yep.
That's the one that we actually prescribe specifically for nausea in pregnancy because it was
Yep.
a prospectively studied medication. So while we're helping your nausea, we're making you sleepy. So these are all the different reasons that we really know about that can actually really cause just exhaustion, not even counting what we're going to get into when we get to the third trimester and just the physical aspect of what the
Yeah.
growing human is causing to your body.
Constantly having to go to the bathroom at night. Oh my gosh.
Yes.
But I
Yeah.
like what the way you talked about the second trimester with you said with your patients, you might say you'll feel better
Yeah.
potentially, but not, I mean, like some people have this idea that the minute they go from first trimester to just second, it's going to be like this glorious change.
Yeah.
And oftentimes it's not.
Right.
But I
Well,
do like,
and what's interesting, I think, I always joke that everything in life is relative. So,
yeah,
relative to the first, you've had potentially like, 4 to 12 weeks of feeling really lousy. So,
yeah,
once you get to that 10 to 12, 10 to 14 week mark, and you're about to be in the second trimester, you might actually kind of feel glorious in that suddenly your nausea is better,
yeah,
right? Suddenly, a lot of those little things might do that extreme exhaustion. I want to take a nap, like you described, might be better. So in that moment, it feels glorious. But at the same time, I also feel like, God, we really kind of oversell these things when we're like, you're going to feel
yeah,
great. And I think that
yeah,
as women, that's something that plagues us a lot, right? We're constantly being told that pregnancy is just so wonderful and
yeah,
it's just an amazing experience. And listen, as I joke, it's miserable and magical, like everything in life. It's
yeah.
wonderful, and yet you might feel horrible. So,
And how often do you see patients who have the exact same trajectory with multiple pregnancies? So if they're having their first versus their second kid
yeah.
versus their third, is it always the same symptoms or no?
I mean, nothing is ever always, everything is
Yeah.
always, and I say this a lot,
Yeah.
but so it's no, I would not say it's always, but I do think to your point, anecdotally, people do seem to have a lot of the same patterns during their
Huh.
pregnancies. Patients who have very extreme nausea, what we have labeled hyperemesis,
Yeah.
tend to have it in repeated pregnancies, whereas patients who have
Interesting.
less nausea don't. Our sleep patterns tend to be the same. So yes, a lot of I think you can expect the same thing in most of your
Hmm.
pregnancies, whether that's good or bad, right?
Okay.
But there are things that we can do. And also, well, we're going to talk about some of the things that you can do about it. I think knowing the signs and symptoms before they occur, many people might think are going to feel like doomsday, like they don't want the negativity. But in fact,
Yeah,
I think you and I agree as practitioners that if we teach people ahead of time, then they're not blindsided by them and they can even take measures into their own hands beforehand to just
exactly.
feel a little bit calmer. Yeah.
And that's how I always talk about once the baby comes too, or babies, like to
I
be
mean,
proactive, to know what it's going to look like. How are you going to deal with it? I'm a huge fan of that. So
yeah.
with all that in mind, what can we do? Let's talk about ways that we can maybe maximize sleep quality in the more basic of ways initially during pregnancy. So are there behaviors that you recommend to your patients, daytime behaviors versus nighttime?
I mean, I think in general, and you know sleep
Yeah.
much better than I do, of course, but
Hmm.
we talk about that term sleep hygiene, which I always
Yep.
laugh, I think is, to me, those terms are wonderful because they can help describe to people in general, pregnant people or
Hmm.
regular people, how they should try to strategize their evening routine. But I
Yep.
really always want to be ginger in how I describe that to patients, in that I don't want to put pressure on them. I mean, you think about it.
Yeah.
You and I are like, I'm a doctor. I run in from home. I'm often have just seen patients or I'm on call. I, have to be with my
Yeah.
kids. I have to like answer emails. I'm not supposed to perform those anti-hygiene techniques like having
Yeah.
my phone in my room, having the lights on, being really
Yeah.
stimulated. And yet I can't live that way. So
Yeah.
to the masses, I would say, of course, we know that we should not have our phone on, ideally in bed, or even within that
Hmm.
like 30 to 60 minutes before we're going to go to sleep because of the stimulation from the light. We should try to have dimmer lights. We should ideally not have caffeine after 2 to 4 p.m., depending on how your body reacts to it. Alcohol, which you shouldn't be drinking in pregnancy anyway, is certainly a no no, but absolutely for sleep disorders, it
Yeah.
even more. On the flip side, things like I would normally tell my gynecology patients to try to restrict their liquids after, 4 to 6 p.m. if they can, so that they don't have to wake up frequently in the middle of the night, because that can often lead to disordered sleep in the postmenopausal patient, for
Yeah.
example. But in a pregnant woman, I don't really want her to restrict her liquids, because if she's restricting fluids, especially water, that might
Yeah.
actually increase her risk of a urinary tract infection or of feeling contractions, what we call Braxton Hicks, or those false labor contractions.
Yeah.
So again, I think we have to dip our toe gently by saying, drink a lot, but try to restrict it not right before try not to drink it too much before you go to sleep, but at the same time, make sure that you're hydrated well, right? And so
Yeah.
we find ourselves speaking out of both sides of our mouth a little bit and just accepting that some of these things are going to be challenging to do.
Yeah, no, that makes total sense. I think even with restricting liquids, people who are pregnant are still going to wake up to urinate regardless a lot of the
Yes,
times.
right?
Yeah, I mean, now what about activity levels? We talk a lot about activity and trying to move I always say like your body is like a battery that's recharging at night. And if you don't use it during the day, you're not going to need to sleep as much at night. So how do you talk about activity throughout the 9 months and
Yeah.
potentially changing?
Well, I mean, listen, I'm going to keep saying this. You know better than I do, but we know that increased physical activity during the day
Yeah.
is absolutely not only important for our metabolism in pregnancy, it decreases the rate at which we gain weight, which also decreases high blood pressure,
Yeah.
diabetes. So those are really valuable. And it seems like it exhausts us in a healthy way so that we will sleep in a more ordered way at night, which is amazing. That
Yeah.
said, patients also have trouble exercising too much because of the
Yeah.
aches and pains and all those things that we'll talk about again in the third trimester. One little bit of research I found, that I don't know how you feel about this or if you found anything that supports this. Typically during the day, naps are a little bit controversial, right? Sometimes people overnap and that means they can't sleep at night, but maybe
Yeah.
there's a sweet spot of just the right amount. We really do know that sleep in general is so important for our brain function and certainly to grow a healthy human.
Yeah.
And so the data that I found was that sleeping less than about 5 hours of night is really not great for pregnancy in particular,
Yeah.
and increases the rate maybe of preterm labor, preeclampsia, things that we know, right? Because
Yep.
that's going to increase our cortisol levels, our stress. But it seemed that while most of the time we're told by sleep doctors that we can't kind of bank our sleep and make up for it by napping, maybe in pregnancy that's a little bit different.
Yeah.
And that was an interesting concept to me. Now, the truth is, most of us, either because we work or we have children at home, are not able to nap
Good luck
very
with that.
well,
Yeah.
right? But I do tell my pregnant patients, like, this is not the time to be completely like your most productive self. You're already
Yeah.
being productive by growing a human and
Yeah.
potentially doing whatever work outside the home you have to do. So if you have the opportunity to sleep next to your toddler, please go take a nap. Like
Yeah.
anytime you can, close your eyes and take a nap.
Yeah.
So I don't know how you feel about that data, but I thought that was actually fascinating because it seemed to fly in the face of the other data that we used to.
Yeah, I mean, it really varies based on, like you said, there's no like hard and fast rules. It really, when pregnancy happens, you have to really kind of modify things. So if someone is not bothered by their nighttime sleep being more disrupted and they're okay with a nap and that's enough to get them through the day, it's not my place to say, don't do this anymore. If
Right.
they're really struggling, they can't get that nap routinely, or they're struggling even with the nap to get enough energy throughout the day and their sleep is really disrupted at night and they're getting far less sleep than they really should be, then we might start talking about the timing of the nap, the length of the nap, what time of day is it happening. Now, that being said, I think something that I struggle with once in a while is the caffeine intake with some patients. So there are some patients who are just really sleepy during the day and can't take that nap. And they're wondering about caffeine. Like, how would you talk about that with your patients?
I mean, the good news is I feel like I can talk about caffeine much more easily with my pregnant patients than with my non-pregnant patients because non-pregnant
Interesting.
patients, it seems like everyone's tolerance for caffeine is a little bit different.
Yeah.
Certainly as a postmenopausal woman, my tolerance for caffeine is less than what it was before. But in
Mm-hmm.
pregnancy, we know that 200 milligrams of caffeine or
Okay.
less, there's a couple of data points that would maybe say 300 milligrams. But in general, we accept that about 200 milligrams of caffeine or less is what we should be drinking outside of for sleep, but for things like risk of miscarriage and
Yeah.
other aspects of pregnancy like hypertension. So the good news I can say to patients, 200 milligrams or less, which is essentially like 1 cup of coffee,
Yeah.
right? Like 1 latte or 1 cup of coffee. And honestly, most patients are doing that in the morning. I don't
Yeah.
want people to suddenly quit their caffeine, which many
Yeah.
women do, because then what happens is they get these rebound headaches and they find themselves chasing the headache with Tylenol, which can be very
Yeah.
safe. I'd rather them have a cup of coffee than unfortunately, be debilitated by the headache or have to take medication to fix the headache that they could have fixed with a safe amount of caffeine.
Excellent
But you and
point.
I know that it's better to do it earlier in the day, of course.
It is. And that being said, I think people just, it's also the routine of I'm going to get up in the morning and make my coffee. Like I do that myself.
Of
But I
course.
think too, if you're someone who we try to limit it 8-ish hours before bed, if you're someone who notices that the morning's not so much of a challenging time, but the early afternoon, that post-lunch dip is a problem, then maybe have a cup of coffee at like 11 o'clock in the morning. Don't have it right at
Hmm.
the beginning so that
Right.
then it might help carry you a little bit in the afternoon if you're not able to take that nap.
Yeah.
So it's okay to have that cup, but maybe think about the timing of it, that sounds like.
Yes. Excellent.
And
I
what
think
about
it's a great idea.
foods? I mean, I know when I was pregnant, I woke up with that heartburn
I
constantly
know.
and the
I
reflux until
know.
I talked to my doctor about it and they're like, take this.
Take this. Yeah.
But are there things that you recommend just like cutting out altogether or positions to sleep in to help with that?
I know. Food is a very also, I'm probably going to overuse the word triggering during our discussion today, but food is very
Yeah.
triggering, right? Because on one hand, we have patients who really do need to be instructed and taught and encouraged to
Yeah.
not gain too much weight during pregnancy, because we know that excessive weight gain, which has plagued me my entire life, that really can increase the risk again of gestational diabetes, preterm labor, challenging delivery, increasing the chance of a C-section,
Apnea.
preeclampsia, apnea, which also just leads to disordered sleep. So
Mm-hmm.
all these things. That said, the pressure on women societally is so immense. And now we
Yeah.
have women who we're exhausted, we're working, we don't have maternity leave, we have a
Yeah.
toddler at home. And now you have a doctor being like, you shouldn't be eating this. And I think, so I think we have to be very constructive in how we discuss
Okay.
it and not just formulaic. All that said, yes, of course, I try to encourage people to not gain excessive weight for all the reasons that we discussed.
Okay.
And I do think that patients know what is causing their heartburn. And so certainly the obvious things like deep fried foods, all those fatty foods that people are eating
Yeah.
certainly can cause more heartburn. And for some people, a lot of the spicy foods and things like garlic and onions, they don't need to suffer. I don't want them to suffer because the medications that we give really are very
Yeah.
safe. So people can take I don't know if we should be mentioning brands, but the chewable antacids they can take
Mm-hmm.
safely. They're not often very effective. So many times they have to switch to the oral antacids
Yeah.
that are very safe to take. And again, there's no need to suffer. And my argument to patients in support of taking these medications is don't be a martyr and think you're doing yourself a favor by holding off on the medicine and suffering through heartburn, because then it's going to lead to disordered sleep. And you actually really need the sleep
Yep.
more than anything else, not as a luxury, as you and I know, but really to help your health. So I
Yeah.
really implore people, of course, you and I will both say, listen to your doctor and ask your doctor, but your doctor should be telling you, take the
Yeah.
antacid if you need it.
I was in that boat.
Yeah.
I remember I was having such horrible heartburn and I was now sleeping. I remember I was like propping myself up when I was sleeping and I was limiting certain foods and nothing was working. And it was like, I couldn't even sleep on my side when I was propped up so much. I finally talked to my doctor and she's like, you're fine to take something. And I was finally able to sleep again. And that was a game changer in my third trimester. So thank you for mentioning that.
I'm going to say this again to all the patients and all the doctors out there. I think sometimes as doctors will say things like, you're fine to take it. But we say it as if you're fine if you need it.
Yeah.
It's not that doesn't mean that that's what we're actually saying, but that's how it comes across to the patient. So they will find themselves holding back and suffering. So I actually always try to really say to my patients, if it's going to help you, I'm going to tell you that I'm instructing you as the doctor to take it. Because if I just say it's fine, you're going to think that you're like, being a wimp by treating your heart, your reflux or your lack of sleep. Whereas I'm telling you medically, you need to treat those things because it will be better for you and the baby. And I know that sounds funny, but I think people need to hear that because all too often they think they're harming someone by taking something when in fact, I don't want to go so far as to say it will harm them, but it can harm them more by lacking sleep.
Yeah, that's a game changer. I really do think the way that things are presented and the way that we speak about it makes a huge difference in the language. So it takes that shame away and that guilt aspect. That's huge. Yeah. So speaking of like the positions, like when I was sleeping propped up and sleep is I wasn't sleeping propped up like that. How do you recommend, like we can talk about pillows, but are there other things that you recommend, positions people sleep in when they're pregnant? What do you do when someone's like, I just can't get comfortable?
Okay, well, two things. I mean, you touched upon it. The pillow really is amazing. I mean, my business partner in Tribe Called V, I will never forget the day she called and she was like, I found the holy grail of pillows, which they didn't even exist when I had my last one 13 and a half years ago, I don't think, or certainly I didn't get it. But that huge pillow that wraps around your body, goes in between your knees. I mean, that really, truly can be a game changer. And I hate saying that because I think from a place of privilege, for many of us, it's like, oh, I'll just buy another pillow. And for other people, it's not that easy. But you can certainly create that same situation by propping a pillow, a blanket, towels in between your knees, prop up the side. We know that in theory, we should all be sleeping on our left side during pregnancy. That said, I'm also very cautious about saying to patients that while I have to cover myself and go by the party line that you should be sleeping on your left side, that the honest answer is if you're sleeping a little bit on your back and you are not short of breath and your legs are not numb, then that means if those faraway organs are getting blood supply, then most likely the uterus with the baby are getting some blood supply too. But at some point during your pregnancy, most of us will feel short of breath, heartburn, and our legs will go a little bit numb. And that's a sign that we should not be sleeping flat on our back or on our right side if that's what's affecting us. So not only pillows, but you touched upon it, sitting in a recliner or sitting in sleeping kind of upright. It's so uncomfortable, but it might be the only way. Because then you're not compressing your big vessels, your vena cava and your aorta and causing that shortness of breath and the numbness. You're not harming the pregnancy in any way and you're able to kind of sleep. But the key is switching positions frequently, right? Because you think you're comfortable and within an hour and a half, you find yourself having to flip over. It's the other reason that I am actually a pretty big proponent and advocate, not of wanting to over-medicate anything in medicine or over-medicate pregnancy certainly, but doxylamine, the over-the-counter sleeping tablet that in America is branded, I don't know if we should say brands, but is Unison brand. Yep. The generic is doxylamine. What's really important to know is that the other generic of it is the gel cap version, which is actually Benadryl, which is a different medication than the doxylamine. But I really feel strongly that patients need to know that that is actually the one medication prospectively studied in pregnancy that has not been shown to cause any harm. And so they can really safely take that and they might need to our point before. So while sleep positions are really important, you might find that you have to sleep in a recliner or with something between your legs. You still wake up uncomfortable, but at least if you take a half a tablet or a tablet to get you through the night, you'll still wake up to pee because we haven't even talked about the peeing yet, but at least you'll be able to fall back asleep. And that's really important because what you don't want is laying in bed with your mind racing, which is what tends to happen to most of us. That 3 a.m. wake up, your mind is racing, you can't fall back asleep.
And I think too, the medication is one option. And I think people are always so skittish about it for
Hmm.
sure. And we also have research, there's not tons, but we have more and more research showing that CBT for insomnia that goes beyond just the sleep hygiene stuff.
Yes.
So that's when I might talk about napping strategies and limiting time in bed and working on worries about sleep. So it could be a combination, which I've done with many people.
Yes.
Patients would be medication once in a while if they don't want to use it nightly, and really trying CBT first if they really.
Yeah.
But the thing is, CBT doesn't work immediately, right? And when you're
Right.
pregnant, you only have
And you
so
have
many
to really,
weeks.
and you have to
Yeah.
really practice it. Well, and
Yes.
just so everyone knows, because I had mentioned CBT to someone and they were like, really? I can take CBD?
Oh, yeah.
I was like, no. CBD, you should not be taking in pregnancy. We
Yep.
don't have great data, but the data we have is you should not be taking it.
Yeah.
CBT, cognitive behavioral therapy.
Yes.
I actually, well, and I want us to talk about magnesium,
Oh,
but
yeah.
I have my own little version of I don't know if you've ever taken transcendental meditation, but TM is a very specific type of
Mm-hmm.
meditation where they give you your
Yep.
own mantra. And
Mantra.
most of my
Yep.
patients just don't really have the time or the energy to go take it's 4 sessions. It's a very discreet, easy class to take, but it still
Yeah.
costs money and it's time. So I've actually encouraged a lot of my patients to make up a 2-syllable word, and right before they go to sleep, put that in their mind
Yep.
and repeat it over and over. And the minute they wake up at 3 a.m, repeat that word
There you
over
go.
and over, because I think it really just detaches their brain waves from
Yes.
that. And so while the physiology of sleep during pregnancy is still going to be somewhat disordered, but
Yeah.
at least if you wake up to go pee, you'll be able to come back and fall asleep more easily
Yeah.
than what usually happens, which is your brain engaging. And I have to tell you, my patients who have listened and done it, it's really a game changer for them. It's what's helped me sleep as a postmenopausal
Right.
patient.
Well, because what you're doing is giving them essentially a mindfulness exercise to focus on.
Mm-hmm.
That's what.
Yeah.
And when you're doing mindfulness, if other things come into your mind, you're letting them go to get back on the exercise
Yep.
in front of you. And that's the
Yeah.
mantra. Any way you want to do it. And I love that
Yeah.
idea.
Yeah.
So yeah, I mean, there are many different strategies. It doesn't have to be medication. It doesn't have to be CBT, not CBD. But I think there are things, and we don't want people necessarily suffering needlessly, but also being, like you were saying, to be realistic that you might still have to get up to urinate. You're going to have to do these things, and it's not going to be perfect, but you shouldn't be suffering with like 3 hours a night, which so many women are. They're just
Right.
up
Right.
ruminating.
And again,
So,
you
okay.
shouldn't be suffering not because we care emotionally about it, but you
Yeah,
shouldn't be suffering because it is not good for the
good.
pregnancy. So that if that
Exactly.
helps convince you, that's what you should do.
Yeah. With that being said, can you talk about the mindset of fear during pregnancy, right? Like some people, I get patients who are in their first trimester who are
Mm-hmm.
terrified of not sleeping, but they don't want to take medication. They want to do CBT, but they're so fearful of that lack of sleep influencing the pregnancy. Like, how do you deal with that with patients when they come in? Because the fear is making them sleep worse too.
I think there is fear across the
Yeah.
spectrum of being a woman, right? We
Yeah.
are fearful constantly. We're fearful when we're young that we're going to get pregnant. Then we're fearful
Yeah.
that we're not going to get pregnant. Then we're fearful that we're going to miscarry. Then once we're done with pregnancy, we're fearful of all the other things, our abnormal mammograms. And so I really try to dissuade
Yeah.
the language of fear. I'm often saying to my patients who probably internally roll their eyes, but I say, fear should be reserved for when we're being chased by an animal in the wild. That is when we need to
Mm-hmm.
trigger our fight or flight and use
Yeah.
the word fear or I'm scared. I think it's very natural and appropriate to voice our anxieties about things like,
Yeah.
I'm worried I'm not going to sleep because sleep is really essential and I like it. And I think that's very valid, but I think
Yeah.
that's very different than saying I'm just so scared, right? And so I really do try across the board when people talk to me about their fears. I think many people want to believe like it's just language, it's not a big deal, but these languages are a big deal. You and I know that when we trigger fight or flight and
Yep.
use words like I'm fearful, I'm
Ugh.
scared, that triggers our cortisol level. Cortisol
Mm-hmm.
is not a great hormone for stress, obviously, and it's not a great hormone for sleep because it leads
Yeah.
to more disorder. So I think really explaining to patients that it's very natural to have some level of disordered sleep, that helping heartburn, helping leg cramps, which again,
Yeah.
we can touch upon magnesium in a second, getting a better sleep pillow or something that's going to prop between your knees, drinking enough water that you're hydrated, but not overdoing it with all kinds
Yeah.
of liquids, especially caffeine. I think kind of strategizing that and making it clear that we will be able to help them get through the pregnancy with CBT, maybe a little bit of mindset modeling on their
Mm-hmm.
own with regard to how they feel, maybe a little bit of pharmaceutical aids with over-the-counter safe
Yeah.
antihistamines like doxylamine. Again, not to mention one of my favorites, which is magnesium. No joke.
Yeah. So let's talk about this. So
Yeah.
there's a difference too between leg cramps, nocturnal leg
Mhm.
cramps, and restless leg. So restless
Yes.
leg, I've had both of them. I
Yeah.
don't know, you were saying that the leg cramps you've experienced. So restless leg is that feeling as the night gets closer, you have this kind of like antsy, you got to keep stretching. And I still have that even to this day. So
Yeah.
that's one thing. And then we often see in people with restless leg, we see, or people who have cramps at night, we see restless leg. And so you can also get nocturnal leg cramps. So so let's talk about the role of magnesium in that stuff, and also with just the calming aspect. It can help to kind
Yeah.
of relax you a bit.
Exactly. Well, this is why I always joke, and I'm sure that like the actual pharmaceutical companies who sell magnesium wouldn't like that they would love it and they would not like it that I'm
Yeah.
saying all these things because again, are they actually indicated for all of this? Who knows? But
Yeah.
I will tell you that anecdotally, most of my patients agree that when they take magnesium, and there's a lot of
Yep.
different types of magnesium, but when they take magnesium, it helps with anxiety, sleeping, leg cramps, and
Mhm.
constipation, not to mention headaches. And to be
Oh,
fair,
interesting.
all of us in pregnancy have at least 4 out of 5. I'd say not everyone
Yep.
gets headaches, but almost everyone gets constipated because the progesterone's slowing our bowels. We almost all get, as we talked about, some level of anxiety and lack of sleep.
Mhm.
And I wouldn't say all of us, but the vast majority of us have these leg cramps. And the leg
Yeah.
cramp, as you and I know, is the muscle in the leg. And sometimes it's not just the leg, it could be your abdominal wall, it could be your feet, sometimes even your hands.
Yep.
Those muscles contract. And so that muscle is constantly contracted and it leads to the most like
Horrible.
inexplicable pain. And
Yep.
magnesium really seems to fix that, along, we think, with hydration and maybe stretching. But to me, patients should, I would say the majority of my patients at some point in their pregnancy are instructed by me to take magnesium, whether
Okay.
it's because of the anxiety sleep or the leg cramps or the leg cramps affecting their anxiety and sleep.
What about like magnesium? There's like creams, all this stuff. Do you ever
Yeah.
recommend that? Okay.
I don't as much, and I'll tell you why. But mostly because those aren't going to necessarily help with constipation. We don't think because it's not
Oh,
getting systemic.
yeah.
I have had patients who said, "Well, I like the spray on my pillow or the cream," and I think if you like it and it works, or taking
Okay.
an Epsom salt bath because that's also
Mhm.
magnesium. I think any
Yep.
of those strategies you like, you might as well. What I found is that again, because it's anxiety, sleep,
Yeah.
leg cramps, and pooping, why
Yeah.
not take one that's going to fix all of those?
I love that.
And it really it can help vitamin D absorption. So there's so many benefits to magnesium, and there's really very little risk in the
Yeah.
obstetric world. We use IV magnesium
Mhm.
when someone is at the hospital to prevent
Yep.
preterm labor if someone's in imminent preterm labor, and to actually and that's a longer story as to
Yeah.
how it actually works and whether or not it actually works,
Yeah.
and to help decrease the risk of seizures from preeclampsia. So
Yeah.
we have a lot of established safety data with magnesium. So again, hands down, I would say that certainly over even the sleeping
Yeah.
medications that we talked about over the counter, but it can be
So
really a game
magnesium.
changer.
That's great.
Yeah.
What about with the restless leg? So I know when I had it initially, I was talking to my OB and we did a blood panel. It turns out that I was pretty iron deficient. So do you
Yes,
recommend
exactly.
that? And then you talk about the constipation, like all that from
Yes,
the iron.
I know. Well, and that's the thing. So it's interesting you say that. Restless leg, which seems to be a little bit less common than the leg
Yeah.
cramps. Again, anecdotally, restless leg,
Yeah.
like you touched upon, can often be from iron deficiency. Or some women, their iron shows up normal, meaning their hemoglobin will look
Yep.
normal when their general blood count is checked. Their iron might even look normal, but their iron stores, their ferritin is
Mhm.
very low. And that's not something we standardly check in
No.
pregnancy or otherwise. And so that can be a reason. If someone has restless leg where they feel that kind of jittery shaking, I will always check their iron stores and their ferritin level.
Fantastic.
I actually would rather us replete women's iron at a higher level than what is recommended. We actually
Mhm.
don't encourage iron unless the threshold is 10.5
Yeah.
in your hemoglobin. That's actually quite low, as you and I know. And
Yeah.
so the reason most of us don't is because that's the guideline and we don't want to cause constipation. But I always say to my
Mhm.
patients, I'm going to be a little bit mean here. I'd rather you actually take the iron, be constipated, and then use the strategies that we can to decrease constipation.
Yeah.
For example, magnesium, because you'll feel better. You'll actually
Yeah.
overall just have more energy, which will probably lead to better sleep and certainly less chance of bleeding when you're actually delivering, less chance of
Mhm.
postpartum depression. So iron itself doesn't have a direct effect on sleep, but certainly indirectly can help so many other functions of your body that it would indirectly help with sleep
Oh,
as well.
once I helped the restless legs, I was actually able to finally fall asleep, right? So it's like,
Mhm.
and then all those things that you're talking about, the sequela. Talk about partners. So let's talk about partners and
Mm.
how if you have a partner who wants to offer support or even a larger network of like friends, family, what are some good answers if they do ask, like, how can I help you if you're not sleeping well? Like, what would you maybe offer for them to say?
Oh my gosh, Doc, I'm only laughing because if anyone saw my face, if they're watching any clip of this, when you said partners, immediate my face went to like, I'm rolling my eyes because I thought you were going down the road of what about if you have a partner, in particular, maybe a male partner who's snoring a lot?
Oh, well, yeah.
So you might be able to fall asleep, and then you got the person snoring there
Yeah.
that even the earplugs doesn't. And so I'm
No,
just going to say this, there is no shame in going into separate rooms if you need
thank
to
you.
during pregnancy, especially because sleep is of such paramount importance. So
Mhm.
tell them to muffle it, tell them to go in another room. You should have access to the most comfortable bed because your sleep really is important for you and for the baby. That said, for the partners who are offering their services and help,
Yes.
I mean, the truth is that's a really hard one because I think, of course, they
Yeah.
could be the ones to make sure they don't keep the light on next to you, don't keep the
Yeah.
TV on, help with your sleep hygiene, bring you a cup of, we didn't touch upon herbal teas, but maybe bring you a cup
Yeah.
of like mint tea, for example. Do the things they can to try to decrease your
Mhm.
stimulation so that you can sleep better. But the honest answer is none of us really want someone policing us. So the last thing I would want is for the partner to say, like, what can I do to help? And then you to say, well, tell me not to have my caffeine at 3 p.m. And all of a sudden they're,
Yeah.
watching over you. So it's a hard one. I mean, I've never come up with, I would love to hear what you say. Are there any great strategies you can think of for partners to help in sleep in general, but for not snoring, not keeping the lights on,
Yeah.
not keeping the television on,
Yeah.
right?
I think whatever you can do to help maximize the chance of you sleeping, whatever they can do to help would be ideal.
Mm-hmm.
But the other thing I was like, even things that are, you might be a lighter sleeper. I know in my third trimester, I was a super light sleeper. So I remember asking my husband when his alarm had to go off in the morning, that would like, I had to get up a little, I could get up a little later. I had him get a vibrating alarm clock. So
Yeah.
something that went under his pillow, like things like that to help
Yes.
with it. And then sleeping apart. And then one thing to add to that is other children. So maybe getting some
Yeah.
help with other kids around the house so you can take that nap if you need to.
Yeah.
Maybe you switch up bedtime routines so that you can get some time to
Exactly.
rest. So thinking
Yeah.
about sharing the load a little bit
Yeah.
more if you haven't been. And then the one thing I was going to say too on top of that is that you were talking about the snoring partner. So the one thing, I mean, we're talking about it more and more, but when you're pregnant, the risk of sleep apnea can increase a lot. And
Right.
so that's something, if you're the person who's starting to find that you're snoring, pauses in
Right.
breathing,
Yeah.
bring that up to your doctor. Yeah.
So yeah, you might be the snoring partner
Yeah.
who is waking yourself up. You might
Yeah.
be the snoring partner waking your snoring partner up. Although I find that like even when I snored during my pregnancy, it did not seem to be waking up my snoring husband. He was like, "Oh,
Okay.
I don't know,"
Yeah.
But
Same
yes,
thing.
to your point, you should bring that up with your doctor. I mean, we haven't yet gotten kind of sophisticated enough to do aggressive sleep testing during pregnancy and offering CPAP and things like
I
that.
know.
But I wonder now with all of these new devices if that's the next wave where we really are going to kind of attach more importance to that during pregnancy. I mean, one way around that,
Yeah.
as you and I talked about, is sleeping a little bit more propped up, maybe sleeping
Yeah.
in if you have access to a recliner or at least pillows underneath just to not have that pressure.
Yeah. I mean,
Yeah.
I think that it's a real access to quick care. I mean, I'm lucky if I have a patient who's pregnant, I suspect apnea, I can call, a colleague of mine and get them in faster, but that doesn't work that way for many people. And it's some of
Right.
the great sleep centers around here, even if you're just not even going to a whole sleep center, you just want a home sleep center, you can take sometimes 1, 2, 3 months.
Yeah.
That's not helpful. So we need to
Right.
get people, like you said, access to care. We need to get them faster treatment, or at least get them evaluated first properly.
Mm-hmm.
So
Yeah.
there you go. So what do you think in the last few minutes we have, what do you think people misunderstand or forget to take into account in general when it comes to women's health and reproductive health?
Oh my God, that's a
The
that's a big
large
one.
question.
I will tell you what I think women forget most. I
Yeah.
think that women, and I don't even know that we forget it. I think women have bared the burden that has been foisted upon us by
Hmm.
society, but unfortunately, we have not readily, but we have taken it on and not given it back. We have bared the burden of
Yeah.
guilt and shame and fear and
Hmm.
cloaking things in secrecy. So all at once, we don't talk openly about our periods. We don't talk
Yeah.
openly about how deeply uncomfortable it is to be pregnant. We don't want to come across as whiny or complaining. We want to show that we're just as strong as
Yeah.
men, which, by the way, we clearly are because we're doing everything they do while we're growing humans, while we're menstruating
Yes.
once a month, while we're becoming menopausal. So I think that I really wish for us as women that we could all at once speak, like I said, more openly, frequently, casually about all of these to
Hmm.
really highlight it, make it a very clear normal part of our world without normalizing the pathological side of it, like terrible
Yeah.
periods, terrible pregnancies, and really make it clear that we need not help in the way that makes us feel helpless or weaker, but we need a collaborative effort, because this is how
Yeah.
people were supposed to actually grow humans, right? Pregnancy
Yeah.
and being a person, we were supposed to do this together. And instead, we've taken on the burden. So that's just one of many things that I think
there's
really
so
needs to
many.
change in medicine
Yeah.
and in society. But again,
Yeah.
I say to women all the time, I hear women use the term guilt so much. I feel so guilty because I heard the baby cry at 3 a.m. and I was so tired. I didn't want to get up, and my husband
Yeah.
got up, and I feel so guilty. To which I'm like, I'm confused. Did you, as I always say, knowingly, willfully inflict harm on someone? If not,
Mm-hmm.
why would you feel guilty? You actually honored yourself
Yeah.
and therefore helped grow a healthy baby. And your husband was then able to attend to your child and create a bond with your child. Why do we allow ourselves consistently to feel guilty? And that's something that is on us. We have to do better.
Okay.
And so I hope we can encourage that in womanhood.
I love that piece of advice. So, Dr. Shieva, we love to end each episode with a segment we call Something to Sleep On. One last piece of advice for anyone looking to change their sleep habits specifically. So when it comes to pregnancy and sleep, do you have any one of all the things we spoke about? Do you have any one final thought for listeners, something to really sleep on besides what you just talked about, which was amazing, like getting help and not feeling guilty about it?
Yeah. Okay. I mean, I'm going to give you two. These are really
Oh,
concrete.
sure.
Two concrete is what we talked about.
Good.
Magnesium and get yourself in a good sleep position.
Love it.
Those two. Yeah.
I think magnesium doesn't get spoken about enough. I mean, I think people think it's this cure-all for insomnia a lot of times. It's not, but in pregnancy and with the leg cramps and all the other stuff, I think it really can be a game changer
it can
for
help
people.
So much. Absolutely.
Thank you. So Dr. Shieva, thank you so much for joining us. I really, really appreciate it. I learned tons during this episode and I had an absolute blast, really. So I know our listeners are going to enjoy it too. So thank you so much.
Well, thank you. It was so fun to be here.
Thanks for listening to Sleep Talking with Dr. Shelby, a Sleepopolis original podcast. Remember, if you're tired of hitting the snooze button, make sure to hit that subscribe button right now on YouTube, Apple Podcasts, Spotify, or wherever you're listening. And for even more sleep tips, visit sleepopolis.com and my Instagram page at sleep.shelby. Today's episode was produced and edited by Freddie Beckley. Our Senior Director of Content is Alana Nunez. Our Head of Content is Molly Stout. And I'm Dr. Shelby Harris. Until next time, sleep well.